I'm Jen Taylor Skinner, and this is the Electorette. On this episode, I have a conversation with professor and reproductive rights advocate Carole Joffe about her new book, Obstacle Course: The Everyday Struggle to Get an Abortion in America. We open our conversation by discussing how legislation has failed to protect access to abortion because it overlooks the everyday obstacles that make it nearly impossible for many women to obtain an abortion.
Well, legislatively, I confess to being very cynical. I don't think that look, the country is deeply, deeply divided about abortion. Those who are pro-choice see these restrictions as inhibiting, often in a very cruel way, women's ability to get an abortion. Those who are against abortion say, yeah, that's the point. We are putting these things in precisely so we don't believe in abortion. So therefore, these restrictions are good because they make it harder to get an abortion. They make it easier to close down clinics. So all this is to say that in terms of the legislative process, I don't think that anything we say in our book will sway those who are opposed to abortion, who put in anti-abortion restrictions. What my co-author, David Cohn, and I are hoping is that those who are pro-choice but do not do abortion work or study or advocacy 24/7, like many of the people we discuss in our book, will come to understand how onerous these restrictions are and hopefully will move to remove those legislators out of office who are doing this.
As people who are pro-choice, when I look for someone to vote into office, right, just to put it simply, it feels like those people, when they speak to us and, they're saying like, vote for me, when they talk about abortion, they talk about Roe v. Wade. And it doesn't spread from there. They don't really talk about all of the little restrictions that have gone into place, which makes exercising your right to an abortion nearly impossible for a lot of women. And that's what I mean legislatively. One of the things that you point out in the book is that, since Roe v. Wade passed, there have been about 1,200 restrictions put into place?
Yeah, by now probably more like 1,300, yeah.
Right, and I feel like none of our politicians are really focusing on those. Or, they have a blind spot and they're only looking at Roe v. Wade. We have to protect Roe v. Wade.
Yes, no, it certainly makes sense. And what I would say in response to that is, of course, it's important to protect Roe v. Wade, and there's a lot to be very nervous about at this very moment about Roe. But what researching and writing this book showed to me is that many women already live in a post-Roe world. In other words, if Roe is overturned, what presumably will happen is it will be turned back to the states. That means there'll be a lot of traveling from what we now call hostile states to, quote, haven states. But that's already happening. One thing that really surprised me, and I've studied abortion more than 35 years, one thing that really surprised me was just the extent of the travel, just the efforts it took to just get to a clinic for so many women.
The really important thing about your book, when I was reading it, you outline the stories of a lot of women. I think the first person you highlight is a 15-year-old teenager, right? And her parents are kind of in and out of the picture. And when you think about the fact that in some states you have to have parental consent, right? And you think about the thousands of dollars that it takes to get an abortion. And this particular person ended up in one of those, what you call a fake clinic. What do they call them? CPC clinics?
A crisis pregnancy center.
Can you just talk us through that scenario of what that might have been like for her, a 15-year-old teenager?
Well, she was extraordinary. We did not interview her personally. We found her story. She had written it up. So I can't speak to her personally, but she had extraordinary determination. What it was like for her to go to the center. She lived in a state where she had to make a separate trip to the clinic 24 hours before the abortion. She got to the clinic. She realized something was wrong. It was a fake clinic. These crisis pregnancy centers, and there's thousands of them. There are more crisis pregnancy centers in the United States now than there are abortion providing facilities. And in a number of states, they get public funding. One of the most of the many things in this world to be enraged about, one of the most enraging things is, for example, in the state of Texas, money is taken away from family planning centers, not even abortion. I mean, Texas, you may be sure, does not give money to abortion clinics, but to family planning programs, contraceptive programs, and gives them to these religiously sponsored crisis pregnancy centers that outright lie to women. They either tell them their ultrasound is so far along that they can't possibly get an abortion, or sometimes they tell them their ultrasound shows actually an earlier stage in pregnancy than they actually are. So these women won't rush, and by the time they get to a clinic, they'll be too late. Another feature of them is that they have been very aggressive about buying property as near as possible to legitimate abortion facilities. And it's often very, very confusing to patients. I mean, this case that we talked about in the book, we call her Talia, it's very common, especially, for example, in a case that we do discuss, there was a crisis pregnancy center had a parking lot right next to a clinic. People from the fake clinic would stand outside, would wave women in, who of course thought that they were being waved into the real clinic. So yeah, this is one of many, many problems that women face when they try to get an abortion.
You know, when I read that story, it was just incredible to me. I was so angry and just appalled at the lengths that they go to lie to women, and and to teenagers who are going through something that's really, really hard. So, and in that case with Talia, this clinic, and you can remind me or tell me if I'm correct or not, this clinic was right next door, very close to it, and it looked very much like the real clinic, and the name was very similar.
That's right.
And when you go into these places, they're they're wearing lab coats to make you think that they're doctors.
That's right.
And it's just unfathomable to me, the lengths that they go through.
Yeah, no, I think you hit the right word on the head. It's unfathomable, the lengths that these fake clinics go to. But it also, Jennifer, I would also say it's unfathomable the lengths that women, not just teenagers, but women in general, have to go through to get their abortions. And they do.
Yeah, they do, right? That gets to one of my next questions. Do we have any data on the percentage of cases where obstacles collectively, where they've been successful, right, in a woman not getting an abortion?
We don't, I mean, that's a great question. We don't have good data on specifically women who were dissuaded or lied to at a crisis pregnancy center. My colleagues here at UCSF in the ANSWER program have come up with an estimate that about 4,000 women a year who show up at clinics are turned away because they arrived too late in gestation. Your listeners should understand that all abortion facilities are not uniform. Some go only through the first trimester of pregnancy. Some go to 18 weeks. Some states, a number of states, have banned abortions after 20 weeks. There's only 3 or 4 clinics in the United States that will perform abortions after 24 weeks, and that's usually for fetal anomalies or the woman herself is very ill. I mean, those are not the only people who get abortions there, but that's the bulk of the cases. So it's a very cruel, vicious cycle. You're a poor woman. You find out you're pregnant. You you look around. You try to find a clinic. You make an appointment. You try to find someone who will drive you there. You try to arrange childcare for your children. 60% of abortion patients are parents. You arrange to take time off from work. So you have to sort of put all these things into place. What we found out is simply getting a reliable ride to a clinic if you don't have your own car, or even if you do. Some clinics use sedation, which means you are not able to drive yourself home afterwards. Anyway, by the time you get all these pieces in place and you show up to the clinic, you may be past that clinic's limit. For example, in South Dakota has only one clinic, and they only go through the first trimester. The same is true for the clinic, I believe, in North Dakota. So depending where you live, depending how reliable your network is, depending on who you can tell, and then what makes abortion different from other procedures is it's not always safe or comfortable to ask people in your network to drive you to your abortion. So all of which is to say a certain number of women show up at clinics and they're just too late. And as I say, my colleagues have estimated about 4,000 women a year show up too late.
Yeah. And so I think you referred to something called the turnaway study.
Yes.
So do we have an idea of what the outcomes are for someone who has tried to get an abortion? Let's say these 4,000 women wanted an abortion, but for some reason could not get an abortion. What are the outcomes and how does it impact the rest of their lives? Because I know it can't be good.
Right. Well, until recently, we had no data on this subject. Thanks to my colleagues here at Answer, we now do have some answers. And your listeners should know that there will be a book appearing on the Turnaway study. We talk about it a bit in our book, but the Turnaway study itself, the lead author, Diana Green Foster, will publish a book that will be out in June on the Turnaway study. And what the Turnaway study did is it exactly as you said, it compared women of similar characteristics, those who were not able to get an abortion that they wanted and those who did. And on every measure, they found out that women who got an abortion did better. They were less likely to become poorer. They had better health outcomes. They were less likely, these are those who received abortions, less likely to be in abusive relationships. And the study went on for 5 years and asked a lot of questions about children. And it turned out that the children of women who got abortions, either these children were already in those families or were born after the woman got the abortion, their children did better. I mean, there was a very important article in the Journal of American Pediatrics, if I'm remembering correctly, just showing that.
You know, I know that there's also, and I'm not really clear what the link is, but I know that there's a link to our high maternal mortality rates with women who are turned away or who try to get an abortion and can't. Do you know what that link is?
You know, I don't. We can speculate that those who don't get abortions may be more likely to attempt abortions on their own. My colleagues haven't studied this. Attempting to get an abortion on one's own today is much less physically dangerous than it was in the pre-Roe era, because we now have medications that some women can get over the internet or on the black market. Let me answer the question this way. It is the same populations in this country who both are most likely to seek an abortion and who are also most likely to be subject to difficulties with pregnancy and birth. I'm talking about, no surprise here, I'm talking about low income, disproportionately women of color. Abortion patients are poor. 50% live below the poverty line. Another 25% live below 200% of the poverty line, which is still poor. I mean, these people would be classified as poor as opposed to, in quote, severe poverty. So 75% of abortion patients who are not entirely, of course, but who are disproportionately women of color, are poor. The women most likely to suffer maternal mortality are also women of color, mainly African American women. Now, I should also say that this country, apart from the abortion issue, this country really has a bizarre, for an advanced industrial country, a bizarre, puzzling rate of maternal mortality for African American women. So you may have heard of the very strange case of Serena Williams. Serena Williams, who at this moment is playing in the Australian Open, fortunately, she almost died. Serena Williams, who is many times over a millionaire, who's a celebrity, when she was in a hospital by now about 2 years ago giving birth to her daughter, she told the nurses, something's wrong. I don't feel right. She had earlier experienced a pulmonary embolism, a very serious medical condition. That ultimately can become fatal if it's not treated. And she, Serena Williams, was not taken seriously, and that sort of became a cause célèbre that even middle class, and it was. I'm talking about Serena because presumably most of your listeners have heard of her and she's famous, but there is a noticeable problem with middle class Black women, and you can't attribute it strictly to poverty, really to racism, the racism that takes place in many healthcare facilities, that Black women's complaints are not taken as seriously as those of others. So rather than linking it to abortion per se, I think the very interesting problem of Black maternal mortality is, and if you compare maternal mortality rates in the United States to countries that we are typically compared to, advanced industrial societies of Western Europe, for example, Scandinavia, our maternal mortality rates are shocking.
I've read the story about Serena many, many times, and I don't talk about this a lot publicly, but the exact same thing happened to me. I'm Black,
really?
but I had a bilateral pulmonary embolism it was a complication from, some birth control and some other things, and wasn't taken seriously. I was misdiagnosed and said something wasn't right, and I drove myself to the emergency room and was diagnosed, but wasn't taken seriously.
Wow.
Was told I had walking pneumonia or the flu or something.
Wow.
And which I knew was wrong, and I nearly met my demise too. So
wow.
I'm well aware.
Well, Jennifer, I'm very, very, very happy that your story ended happily. That must have been terrifying.
It was terrifying, just how close we are, at any moment, especially the pulmonary embolism, because there are almost no symptoms until it's too late, right?
Yeah.
And like you said, it's not necessarily an issue of poverty, because I had, doctors around me. It's a matter of, how they view us and judgment and, a lot of other complicated things.
Yeah.
So it's not like I didn't have access to healthcare. It's just that the healthcare I had access to, had some biases. So
yeah. Well, I am very happy that this very scary story ended well.
Me too.
Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Well, I do want to ask you, because you ask a really important question in this book, and you ask, whether all of these restrictions, are they unconstitutional, right? Because we assume that we have protection for access to an abortion under the Constitution via Roe v. Wade, but the fact that these obstacles are making it impossible, are they together unconstitutional?
Well, great question. We thought we had a real victory a couple of years ago in the whole women's health case in Texas. Just to back up a little, an earlier Supreme Court case said that restrictions were constitutional as long as it did not place a, quote, undue burden. That was Sandra Day O'Connor's contribution. It was, anything was constitutional as long as it did not place an undue burden on a woman seeking an abortion. But no one ever defined, including her, the Supreme Court never said what a, quote, undue burden it was. So what happened is that states kept doing restriction after restriction after restriction. For example, in Several states, there is a 72-hour waiting period. Now think of a woman in Utah, South Dakota, both of those places have them. Utah, there's maybe 2 clinics. South Dakota, only 1. And South Dakota is a huge state. Think of a woman driving across the state, leaving her kids. South Dakota has this other restriction. You have to come on one day and be counseled by a doctor, and your abortion has to be with exactly the same doctor 72 hours or more later, and they only go up to 14 weeks. Now, you tell me how, if from a common sense way, that's not an undue burden, but
Right.
but the courts upheld it. Anyway, so undue burdens were never really satisfactorily defined. States did whatever they want. If you, meaning the legislator, think this is in a woman's interest, then fine, do it. Whole women's health was a breakthrough. It was in 2016. It was before the decision came down in June, before the very fateful November election. And the state of Texas had said all abortions have to take place in a so-called ambulatory surgical center. In other words, basically like a little hospital. You had to have the same specifications of storage room for janitors, and the hallways had to be certain width, and the airflow had to be this and that. Things that maybe make sense in a hospital setting absolutely have no health benefits for outpatient abortion. And the court, Justice Scalia had not been replaced yet, so it was 8 members of the court. The good guys won, or the good people won, I should say, since 3 women voted in the majority. The majority in Whole Women's Health said, look, there has to be scientific evidence showing that these restrictions, besides the ambulatory surgical center, that doctors at the clinic had to have hospital admitting privileges. That's not how medicine works anymore. If somebody would have a complication with an abortion, and which is, by the way, extremely rare, abortion is 14 times safer than childbirth in terms of what women die from. But if there is a complication, most likely she'd go to a hospital back to the community that she came from, or she would be treated in the ER in the city where the abortion was. And none of the local hospitals in Texas were willing to give admitting privileges to Whole Women's Health Clinic. So the court in 2016 finally said no, an undue burden, you have to show it's based on scientific evidence. You have to show that there's actually health benefits. And it turned out that the lawyer for the state of Texas was absolutely unable to do it. Again, my colleagues from UCSF, not to be too promotional here, but I am very, very proud of my colleagues, as well as a wonderful research team at the University of Texas. These 2 groups collaborated. They showed exhaustive evidence, how many miles women traveled, and why it simply made no sense. And the court said, no to the state of Texas. You're not showing any benefit. So they struck down those restrictions in Texas. And we, meaning the pro-choice movement, we were all rejoicing. Finally, some rationality in the Supreme Court. Finally, these restrictions that make access so difficult, finally we're done with them. But it turns out the elation was short-lived. This March, the Supreme Court will hear yet another abortion case, this one from the state of Louisiana. It's called June, which is the name of the clinic, versus Ghee, who I believe is the health commissioner of Louisiana. And it's about hospital admitting privileges. It's like the previous Supreme Court case never happened. And the difference between the composition of the court in 2016, now, of course, we have 2 new justices that have been appointed by Donald Trump. We have Neil Gorsuch. We have Brett Kavanaugh. So it is, as you might imagine, a very, very worrisome what will become not only of this case, but, will this whole women's health case have any meaning with a very conservative Supreme Court?
Yes. It's just when I hear about all of these things just collectively, first of all, it just makes me really angry. And then also I think that, perhaps maybe some of us, most of us became outraged a little too late because like you said, since 1973, there have been over 1,200 restrictions like this, right? And had we fought them as they were happening, perhaps we wouldn't have this ditch we'd have to dig out of. Because I just feel like it's whack-a-mole, one case was heard in Texas, what was that, 2016? And now we're in 2019 and a similar case is coming back. It's just, I don't really know what to do.
I think you raise an excellent point. The pro-choice movement worked very hard in the years leading up to Roe. There was a medical wing of the pro-choice movement, doctors who had seen what happened to women when abortion was illegal. There was a feminist movement, a second wave feminism, the late 60s and early 70s. So both feminist health activists as well as medical activists worked very hard to get Roe passed and accepted socially. And then basically, I have to say the pro-choice movement pretty much went home. The anti-abortion movement, however, mobilized immediately after Roe and has been extraordinarily successful and effective. Finally now, some may say too little, too late. Some may say, thank goodness. Now we're seeing more of a proactive pushback from the pro-choice movement. For example, even though there's been 1,200 restrictions passed since 73, in the last couple of years, we've actually seen blue states getting bluer with respect to abortion. And that's very encouraging. And if any of your listeners who are pro-choice have any doubt that elections have consequences, let me give Exhibit A, the state of Maine. Maine had a Republican governor. He was defeated in 2018. A woman governor, a Democratic woman, won. Since then, the Maine legislature has passed Medicaid coverage for abortion. The federal government does not allow Medicaid payments for abortion. And as I said before, most women who get abortions are poor and therefore on Medicaid. Only about 15, 16 states have decided to use their own funds to pay for poor women's abortions, and now Maine is one of them. Another very important thing that Maine did after this election, they said that you don't have to be a physician to offer abortions. Maine joined a number of other states in allowing what we refer to as, quote, advanced practice clinicians. That's nurse practitioners, nurse midwives, physician assistants, who are very capable of safely providing abortions, especially the earlier ones. And so now Maine does that. And a number of other blue states have taken steps to make abortion access easier. And that's wonderful. It doesn't help the women in South Dakota or in Alabama directly, but what it does mean is that when Roe is overturned, if the pro-choice movement figures out how to get women from hostile states to haven states, there still will be states that are providing abortion.
Yeah, well, two numbers I want to mention. They have a 40-plus year head start on the pro-choice movement, right?
Yes.
And then secondly, you mentioned that I think 90% of the counties in America don't have an abortion provider. So only 10% of our counties have, places where a person can get an abortion. That just seems, I don't want to be a downer.
Well, it's okay. In this field, it's okay.
It's a lot to overcome. Blue states or not. I guess the thing that bothers me is that, whenever these surveys are done, the majority of the country is in favor of access to abortion, right? So the majority of the country, they're in favor of women having access to abortion. However, these anti-abortion people are just louder and more aggressive. And, somehow they've, made it just terrible for the rest of us. Just to put it simply.
Well, you're right. I would, just to put things a little bit in context, that 90% figure is a little bit misleading because the population is not distributed evenly. It's not.
That's true.
So 90% of American counties don't have abortion does not mean that 90% of American women live in one of those counties. So it's not quite as bad as it sounds. The figures, I mean, I don't have them at my fingertips. I believe, and I urge any of your listeners, if you really want to know, to double check on me. I mean, I'm a professor and I do not like giving false information. I believe it's 1 out of 3 women live in a county without a provider. I could be wrong, but we do know that it varies enormously. So, for example, again, some of my colleagues here at Answer did a study on so-called abortion deserts. They found 27 major metropolitan areas, mostly in the South and Midwest, that are over 100 miles from a clinic. So if you live in San Francisco or New York or in Seattle or in Portland, arguably there's an oversupply of abortion providers. I mean, there's many, many options to choose from. If you live in Nebraska, if you live in Kentucky, you're living in we now have 6 or 7 states with only 1 clinic. If you're rural, even in blue states. So, for example, New England is basically very pro-choice. There's very few restrictions in the New England states as a whole. I mean, New Hampshire, a little bit more mixed than some of the others. But those are big, big states with severe winters, without good public transportation. So even in blue states, some women do have problems. And one of the things that we noted in our book, was how important this army, this unheralded army of volunteers is all over this country. I mean, the situation no doubt is serious, but all over this country, there are what we call allies, people who work in organizations like abortion funds, who turn themselves into pretzels to help women get the money, not simply get the money to pay, but also help find them rides. Besides these allies, we also have a huge, huge network of volunteers, people who, without getting paid, really go to extraordinary lengths to help people. My co-author David and I spoke to providers and allies and some volunteers in all 50 states. And one of the most extraordinary stories that we heard was this woman at the time in her mid-60s. She was in a southern state with only 1 clinic. She agreed to pick up a woman who lived about an hour from where the clinic was. And she took her to the clinic in the South. The clinic, turns out the woman, for various reasons, couldn't be seen at that clinic. She had very high blood pressure, and they just didn't feel safe doing her procedure. They called a national organization, and the national organizations referred them to a clinic in Washington, D.C. This woman drove from the South to Washington the drive was about 10 hours. And turns out in D.C., they also couldn't see her. So, okay, but you know where you can be seen? In New York. There's a New York clinic that will. So now they're on a 3-day road trip. It's right before Christmas. The woman getting the abortion desperately wanted to be home, by Christmas for her kids. So they go to New York. They go to a clinic. The abortion is started. By now, the woman is well into the 2nd trimester. They're in a hotel room together. So this woman, we call her Pat, this woman, Pat, who had driven the stranger from her home state to D.C., now to New York. Now they're in a hotel room. She's supposed to go back to the clinic the next day to complete the procedure. Some procedures actually take 2 days. And then a very not unheard of but unusual thing happened. In the middle of the night, this woman started to deliver the fetus. So Pat had to call 911. The emergency people came. They took her to a hospital. They finished. I mean, she was in the hospital. They did finish the procedure. Now it's the day of Christmas Eve, December 24th, the third day on the road. So they start by now it's a 12-hour drive back to where they were going. Horrible rainstorm.
Oh, no.
At one point, they had to stop because there was no vision. Literally a minute before midnight, they make it back to this woman's house. And as Pat said to us, I got her home to her kids for Christmas. Now that story is beyond the beyond. But but it's true. But that is the kind of things that people in this world are willing to do. And it's deeply, deeply moving to me to see, this level of humanity, of trying to help your fellow human beings. At the same time, however, what I would say is, as much as I respect and honor what these volunteers do, this is not a good way to do healthcare. No. We can't always assume there's going to be a Pat who's willing to go on a 3-day odyssey with a stranger and call an emergency in the middle of the night and drive in a blinding rainstorm. When it happens, it's wonderful, but we can't count on it. I've heard stories over the years, not just doing this book, but from previous research I did, of rides that didn't show up, of people who flaked, of women left waiting, and then they were too late for their abortion. In other words, this is not how healthcare should be. Abortion is healthcare. Healthcare should be accessible. So as much as I have phenomenal respect and admiration for what these volunteers do, I want abortion to be normalized.
No, you're absolutely right. I read the story in the book, and you talk about some other organizations and volunteers. Another obstacle is cost, right? Like it can cost thousands of dollars to get an abortion, right?
Well, it depends. Relative to other health cares, abortion price most abortions take place in the first trimester, about 90%. The average price of a first trimester abortion is $550, $600. For a woman who has nothing, who lives in her car, or whose electricity has been turned off, it might as well be $10,000. But later in pregnancy, the price goes up. But first trimester is about $600.
And that's what I would expect. So I know that it's about $600, but it can go up to thousands of dollars, right?
Yes.
That's one obstacle. Yes. And so I know that there are volunteers that, there are organizations that help pay for the costs. There are organizations that help, they escort you to clinics to get through protesters. There are organizations that provide transportation. There are lots of, really big-hearted, good people who are helping women get this healthcare, because abortion is healthcare. Mm-hmm. But like you said, and I'm going to be a downer again, this should not be necessary. Mm-hmm. It is healthcare, right? Mm-hmm. You don't have to go through these lengths to get a mammogram.
That's right.
So that's just my point. I just wish that, obviously, which is why you wrote the book, that it didn't have to be this way.
Yeah, I agree.
You agree, because you wrote the book. One of the things that I had trouble wrapping my brain around was the fact that you actually have doctors, physicians, medical professionals who are, it's their responsibility to treat women who are against abortion, right? Mm-hmm. Just to imagine that scenario. A woman goes in, because we have this culture around pregnancy that it's a good thing. Everybody wants it. Everybody wants a child. It's a moment to be celebratory, right? So when there is a doctor who is, anti-abortion, and a woman goes in, that culture just, smacks the situation in the face. Sometimes he has to refer her to a different doctor. Preferably that's what happens. Mm-hmm. But in some cases, I think there's one in your book where the doctor was pretty hostile and was saying things to the woman while she was getting an ultrasound, like, are you sure you want to kill your baby? Mm-hmm. Is that a story from an actual doctor, or is that from one of the fake clinics, the crisis center clinics?
No, that's from a real doctor.
Wow.
Look, abortion is arguably the most polarizing domestic issue in our society. I think doctors as a whole are probably more pro-choice than other segments of the population, but there are many doctors who are personally anti-abortion. I mean, the American College of Obstetricians and Gynecologists has a pro-life caucus within it. So yes, some doctors are very hostile to abortion. If a doctor says negative things to a patient, that's not right, and that's upsetting. But I'll tell you, Jennifer, what upsets me much more is that in a handful of states, I believe about half a dozen, doctors cannot be sued if they lie to patients, meaning
Right.
that if a patient comes in pregnant, and let's assume she wants to be pregnant, but if her ultrasound shows something very serious, like some kind of anomaly that would very likely lead her to want an abortion, if the doctor doesn't tell her that, he or she cannot be sued.
Wow.
Under state law. I mean, that blew my mind. I mean, I thought after studying this field for many years, I was beyond shock. But the idea that a state would pass a law saying to doctors, yeah, it's okay if you lie to your patients, that blew my mind.
I'm kind of speechless right now. I did read that, but when you said it, when you said it out loud, I was just thinking about, I have 2 children, just thinking about in my own case, I trusted my doctors. I trusted that they were telling me the truth. Like, what if they were just lying to me? And wow, I can't imagine. You said 6 states or half a dozen states?
Yeah, I think Arizona was the first.
But and maybe I'm wrong about this, but that seems to me more harmful than the protesters. Now, the protesters are terrible people, right? They accost women as they're trying to go in for their, abortion health care. They throw, doll parts at them covered in red paint. These are terrible, terrible people. But at least you know where they stand, right?
Yeah, that's true.
When you go to your doctor, the assumption is that your doctor will give you the best information that he has for your life. And then the fact that they can lie to you and there are no legal consequences just blows my mind.
It is shocking. Yes, it is shocking. Now, how often it actually happens, nobody has really calculated to my knowledge. I don't know how many women there are out there who've been lied to in that way. I simply don't know. The fact that the law even exists symbolically, I think, is very negative. In other words, what does it mean to have a law on the books that says abortion is so horrible, so stigmatized, that something we would not let you do in other contexts, like if you lied to a patient, you told her she had a cancer that she didn't, or you told her she didn't have cancer when she did, that would be unacceptable. The patient would have every right to sue. The fact that in this abortion case, it's okay to do that, and even if the law is never challenged or even if it's never used, the existence of law itself is very disturbing to me.
I do have a question about the counseling that you mentioned in the book. You talk about how there's this requirement that some clinics counsel women, who come in for an abortion. And I don't really understand the rationale behind that. Why is that necessary? I mean, it is an emotional decision for some women, not all women, but for some women, right? But a lot of healthcare decisions are really emotional. So why the counseling? Why is that a requirement?
I'm glad you mentioned the counseling because it's very similar to what we were just talking about doctors being able to withhold information. In a number of states, the state legislature has mandated that abortion clinic staff, sometimes it's the doctor, sometimes it's other staff people, that they literally have to tell lies to their patients. So, for example, if you come to a clinic in a certain state, they'll tell you abortion, if you are at higher risk for breast cancer. That's not true. You are at higher risk for suicide. That's not true. You will have difficulty having subsequent children. That's not true. So this is really shocking. Now, the other thing I told you about the doctors being able to withhold information about a fetal anomaly they see on a screen, on the ultrasound, I don't know how often that happens, if it even happens. But we do know that every day in about more than half the states, women go to a clinic and are told lies. Sometimes the doctors say, the state requires me to tell you this. The women get very upset. They've just been through a gauntlet of protesters. Now they're inside the clinic and someone is telling them they might get breast cancer. I mean, that really is egregious. I mean, egregious, and it happens every day.
Yeah. I don't know if you have numbers on this, but I'm curious as to how effective protesters are, right? Like they're a nuisance and they're, like I said, they're terrible people. But do we have any data to say that they are successful in people, not getting an abortion? There's something in your book that you talk about the myth of uncertainty, right? Because I think they're operating on this assumption that women who are going in for an abortion are uncertain. They're unclear about the decision that they've made. So if they just harass them enough and make them feel terrible enough, that they'll turn around. And I don't think that that's necessarily the case.
Right. No, in fact, again, I hope you'll forgive me. Again, I will cite my colleagues here at UCSF. Just within this past week, a very important study came out led by a researcher called Corinne de la Rocca. And she, as well as others, studied decisional certainty. They followed women after 5 years, high 90s. Yes, the abortion was the right decision for me. Most women, a very high proportion of women who go to a clinic are decided, they've thought about it, they want an abortion. Some small portion are really ambivalent. And what clinics do, and I think I'm glad we're talking about this because I don't think this is widely understood. When clinics see a woman who's truly torn, she wants the abortion, but she's crying. She maybe says to the counselor, "Will God forgive me because I'm a murderer?" When women say things like that, what clinics typically, and it's only a small portion who do, but there are some, clinics will simply say, take another couple hours to think about this. Or why don't you come back tomorrow if you're still sure you want it? Nobody who works in a clinic wants to give an abortion to a woman who doesn't want one.
Wow. So this is a hard question to ask because I would not know how to answer this, but you've been doing this for your entire career. How do we tackle this? Because there's so many obstacles. Like, I don't know how many we've talked about here, but just how do we reverse this trend?
This is not a very original answer. You vote. I mean, we saw in the 2018 election that when there's now a woman governor in Kansas, a Democratic woman. That is huge because Kansas used to be one of the most hostile states. That's where Dr. George Tiller was assassinated. It was, and in some respects still is, a very divided state. But now we have a woman governor who's not going to sign crazy legislation, even if the legislature passes it. But we also need to support clinics. I don't want anybody hearing this to think that if you volunteer at a clinic, you'll have to drive to 3 states over 3 days, like Pat did. But but you can do very, very important, helpful things. It's very important to the extent one is able to donate. Now, there are obviously a lot of very worthwhile issues competing for people's dollars, not the least of which is the campaign itself. But what the future of abortion will be, whatever the court does, whether Roe is overturned or not, what doing this book made very clear to me is there's already a lot of traveling going on. And that costs money. It's the poorest women in our society who are needing to get some of the most costly procedures, costly because they need to travel. They need places to stay when they get to a state that has waiting periods. They need childcare for their kids. So voting, money, volunteering, those are my 3 asks.
Well, Carole Joffe, thank you so much for your work. And thank you for writing this really important book.
Well, thank you.
Thank you for listening. The Electorette is independently created and produced by me, Jen Taylor Skinner. And of course, I'm the host. But I also do all of the editing, the audio, and the graphics. You name it, it's on my plate. So if you enjoyed this episode of The Electorette, please help The Electorette grow by subscribing. Just hit the subscribe button on whatever app you use to listen to podcasts. Also, leave a review for the Electorette on iTunes. Lastly, one final way to help the Electorette is by following the Electorette on social media. That's at Electorette on Facebook, Instagram, and Twitter. Thanks again for listening, and until next time, keep up the good fight.